Hi, guys. It's Kelly and Blake, and we are part of your education committee. And today we're going to talk to you a little bit about our new considerations for treatment and discharge.
And just a quick little preamble about what that is. It's just another option for us to give the patient, to advise them that they don't have to go to the hospital as long as certain conditions are met. Of course, if they outright refuse, well, then just go ahead and do that refusal. We'll cover a little bit on the fact that in iMedic, there's procedure codes for each of the SVT, hypoglycemic, and seizure considerations for treatment and discharge that have a full list. I think it's a checkbox.
I think so, yeah.
And you can go through that with the patient to ensure that they do meet the requirements for these. I'm going to first cover the considerations for treatment and discharge when it comes to SVT. Of course, the patients are always going to be 18 to 65 years of age for all of these protocols. In this case, they have to have a prior history of SVT, and when you look at the rhythm, it's going to be narrow complex and a regular rhythm. And they'll only have the one episode within a 24-hour period. And after treatment or it returning spontaneously, and so by treatment I mean either Valsalva maneuver or through adenosine, that they've returned to a normal sinus rhythm and they are asymptomatic. Their level of awareness should have returned to normal, and that their vital signs are within normal limits, especially their heart rate being less than 100, and maintaining that for 15 minutes after they've converted. The big thing that need to know is the fact that there's been no cardioversion given. They're not pregnant. There's no alcohol, any sort of substance abuse or withdrawal symptoms, and that they don't have a fever.
Hi, and I'm going to talk to you today about your considerations for treatment and discharge of our hypoglycemic patients. So as Blake had mentioned before, our patients need between 18 and 65 years of age. They have to have a history of diabetes. The hypoglycemia must be a result from perhaps taking too much insulin and not enough carbohydrates after they've taken their insulin. The hypoglycemia has to have responded to a single treatment of our dextrose, our glucagon, or oral glucose, or other complex carbohydrates. This was a single episode that's happened in the last 24 hours. With our treatment, blood sugar must now be 4 or above. The patient has returned to their normal mental status. We have done a complete set of vitals, and they are all within normal ranges. This was not an intentional overdose. The hypoglycemia was not related to alcohol or substance abuse or withdrawals. There was no seizure activity reported prior to this. The patient is not pregnant, and the hypoglycemia is not part of an acute illness. And the patient is not on any oral hypoglycemic medications.
And now I'm going to finish off by talking about our consideration for treatment and discharge of our seizure patients. As always, they have to be between 18 and 65 years of age, a history of epilepsy, currently taking anticonvulsant medication and, taking their medications as they're required. Although in most cases, that's usually why their seizures have come on. They should only have had a single seizure in the past 24 hours, and the pattern and duration of these seizures are what is normal for the patient. At the time that we're dealing with them, that they have a normal level of awareness, they're back to their regular level of mentation for them. Their vital signs are within normal limits, and be sure to include a temperature to ensure that that's not part of the problem. With that, we also need to make sure that it's not related to a low blood sugar, alcohol consumption, substance abuse, or withdrawal. They cannot have any midazolam, Versed, given by EMS. make sure that there's no injuries, and of course we want to ensure no fever preceding the illness, or that they've started taking new meds, and that they're not pregnant. So as both Kelly and I have dealt with the considerations for the treatment and discharge for SVT, hypoglycemia, and seizures, then we have to go into the requirements that need to be met. First off is that a responsible adult needs to be with the patient for the next 4 hours.
Your hypoglycemic patients, they need to have, somebody needs to make sure, either them or the responsible adult that's with them, that they are going to be eating some complex carbs afterwards.
Any questions that they have, you should answer them to the best of your ability and knowledge.
We're also going to advise them to follow up with their health care practitioner. It may not be their family doctor, or maybe their nurse practitioner, whoever takes care of them.
Mm-hmm. And the next two requirements that need to be met are basically the same thing, saying the fact that they have to have an ability to call 911, and that they should call 911 should the symptoms return or persist.
And then our final is that the patient and the substitute decision maker, either or, are giving consent to be discharged. And they, again, make sure that you explain everything to them and that everything is covered and they don't have any questions.
And if you look at the very bottom of the protocols, it'll say that if you have any concerns or questions, feel free to do a base hospital patch and consult with one of our physicians to ensure that all these conditions are met and that everyone is happy with the decisions being made. All right? Just want to quickly touch base on the fact that these checklists are available on iMedic. And feel free to pull that up and have a look. And what you can do is have your laptop with you and the patient, and you can actually go and click off each one of these, your considerations, and then the requirements to ensure that legally wise you are all covered. All right?
All right. Thanks, guys.
Take care.